right, well, good afternoon, everyone, and thank you so much for joining us today. I'm Jennifer Hancock, the President and CEO here at Volunteers of America. We are just so glad to have you at our Recovery Community Center. I want to start just by expressing how excited we are to be in Somerset, Pulaski County, and how much appreciation we have for the very warm reception we have received from the moment we started engaging in the community and expressing our desire to locate services here. In August, we hosted a ceremonial ribbon cutting for this community center, and we're honored to be joined by Mayor Keck, our friends at the Somerset Pulaski Chamber of Commerce, Chris Girdler from SPEDA, Judge Venters, who's one of the key impetus for us coming into Lincoln, Pulaski, and Rockcastle counties, our Regional Advisory Council, and many more supporters and stakeholders at that event. I have to also recognize our mayor from Stanford, Dalton Miller, who's here, who's been a wonderful friend to Volunteers of America and serves on our Regional Advisory Council. And I want to tell you a little bit about VOA and the spectrum of services that our organization provides and why it is so special to have us gathered here today to talk about the amazing and transformational work that is happening here. You know, we're a behavioral health and a human service provider, and we create positive change in the lives of individuals in our communities through a ministry of service. We were founded 128 years ago, and we operate today more than 30 unique programs across the Commonwealth, as well as Tennessee, West Virginia, and a couple of counties in southern Indiana. Our programs include addiction recovery services, of course, our veteran services, including suicide prevention for our veterans, housing and homeless services, public health services, comprehensive care for individuals who have intellectual and developmental disabilities, and a restorative justice program that helps to keep youth out of the criminal justice system. If you know us, you know we're not interested in bragging about outputs or the number of people we serve. What we care about is real outcomes. That is the real and measurable change that we create in people's lives because of their interaction with our organization. Today, we have the distinct honor of providing General Coleman, Director Evans, Deputy Director Halliday, and Commissioner Allen with a tour of this Recovery Community Center and a site visit to update them on the incredible outcomes we have witnessed with their generous support so far. Seeing the ravaging effects of the opioid epidemic and the substantial rise in cases of substance use disorder right here in this region, we established our first Recovery Community Center in Manchester in 2019. And of course, my friend Joe Farmer from Manchester is here. He helped us launch that now more than 5 years ago. In general, you were there in a different role when we cut the ribbon back in 2019. That facility, as I mentioned, we just celebrated our 5-year anniversary. It has been so successful. It has been a treasure to the community. And in fact, it is the model we have used to mimic what we have here today. And we have an amazing team led by Maria Thompson, who the Attorney General and his team just had to hear an inspirational testimonial from her. So thank you, Maria, and all of our team for the work that you do here. This is a community resource. It provides education and information, support, and sober socialization for those in recovery, as well as their friends and family. Our program focuses on peer recovery support services to assist in removing barriers and removing stigma, while at the same time providing those necessary resources to maintain long-term sobriety. The Recovery Community Center also hosts a lot of fun, sober events like a Halloween party later this week for its members to gather and connect as they continue their recovery journeys. It's become apparent that services like the Recovery Community Center are needed in every region of the Commonwealth. We are so passionate about that. So we've worked hard to bring this program to even more Kentuckians. And with the support from the Attorney General's Office and the Opioid Abatement Advisory Commission, we have been able to bring new RCCs to Lincoln County, right here in Pulaski, as well as Rockcastle. I have to give a special thanks to General Coleman's predecessor, Daniel Cameron, and his staff for initially selecting VOA as one of 2 organizations that received a $1 million grant in its first distribution to launch 2 of these RCCs. It's relational, and it's focused on getting real results. And with that, it's my pleasure to turn it over to someone whose leadership I admire and whose fierce dedication to these issues is nothing short of inspirational. So please help me in welcoming our Attorney General, Russell Coleman.
I take full responsibility for us running a few minutes late, so I accept that. No event hosted by Jennifer Hancock would ever start late based on her leadership, but that's totally on me. And the reason we're late is we sat in a room just a moment ago and heard about the impact of this facility on 3 counties. Not just numbers, and the numbers are impressive. The numbers served walking through that door in Rockcastle and right up the road in Lincoln County, the over 4,000 visits. For the numbers, the data is important. Evidence is important. As VOA and our office and the commission, we want measurable evidence and impact. It's not just about talking from podiums like this. But what we heard was about lives changed. And what we heard was about the before and the after, and the long struggle, the challenge of recovery. And a facility that, while nothing is easy in this process, but a facility that serves as essentially a Swiss Army knife in helping facilitate and holding the hand of those that need services. That's what we heard about from Maria, and what we saw firsthand was some extraordinary leadership. And so, Maria, thank you for your leadership of these facilities. I've learned very early on as a prosecutor and as someone who spoke from podiums, is so oftentimes the work that brought us to the podium takes place not here. Those who brought us to the podium, most of the time they're standing in the back of the room. Most of the time they're not in front of the camera, and that's a great example, Maria, and those peer counselors, those that are standing in the back of this room. I'm grateful for what you do in saving lives. And Jennifer, thank you for opening the doors of this facility for us. Jennifer and I have been friends for several years. I've seen her leadership in numerous contexts, and she is, I say without any hesitation, one of the most effective leaders in this Commonwealth, if not across this nation. She really is a superstar. On behalf of the Office of the Attorney General and the Opioid Abatement Commission, I'm grateful to have this partnership with VOA. I'm grateful to partner with the pros because through our long-term partnership, we're saving lives. We're saving lives. Again, far from podiums like this, but at the lowest point in the lives of so many. I could not be more honored to be a small part of that partnership. As you may know, certainly Jennifer spoke to it a minute ago, the Opioid Abatement Commission is responsible for distributing the Commonwealth's share of settlement funds from the opioid abatement litigation. Funds that were brought back to the Commonwealth from those distributors, producers, and marketers of the poison that brought us to this point, that destroyed communities, destroyed families. We view this money, as do so many families across the Commonwealth, we view this money as blood money. This is blood money that has been purchased by pain and loss and destruction. So it is incredibly important to me, it's incredibly important to our team that we are stewards of this money. And those of you know that term steward and stewardship has a spiritual connotation to it. We must protect it and we must grow it and have an impact. And so that's why I'm so glad to stand here, to sit in that room, to spend time at this recovery center, a place that is stewarding that money and saving lives. In the last 2 years, VOA has received 2 grants from the Opioid Abatement Commission, totaling more than $1.6 million. That is an investment. That demonstrates trust. That demonstrates a partnership where stewards are allowed to put that much money, not at risk, but in play to save lives. And I will tell you, looking around this room today, I am impressed by the other partnerships, by the relationships across counties, across cities, across sectors. You're demonstrating that partnership and relationship is what will allow us to, the legislature says and directs us to mitigate the harm. That's the term, mitigate the harm caused by opioid addiction. And we will do that as a floor, and we will follow the direction. I'm a lawman, we follow and enforce the law, but I will tell you, we're not mitigating. We're not just mitigating. Mitigation's a floor. We're gonna win. We're gonna bring back communities from this harm. We're gonna save lives. We're gonna save families. That goes far beyond mitigation. We know we can never fill those empty seats next to you at the pew. We know we can never fill that empty chair at your kitchen table. We're not gonna do that. But again, we're gonna save lives with this partnership. And I will tell you, our Commonwealth is home to some strong networks, some solid leaders, not just here and in Rockcastle and Lincoln. I've met some inspirational leaders like Diana Rob Perez in Lexington. If you've never been to DV8 Kitchen, looks a little different. You see graffiti behind me on the wall. But I'll tell you, when you open the door and smell what's being baked, what's being cooked, the Perez's use a job and work and the dignity of work to help save lives. It's a different partnership. It looks very different. The opioid challenge we have across this Commonwealth looks different in the West than it does in the East. It looks different in Louisville than it does in Fayette County. That's why every one of these partnerships looks a little bit different. The creativity is a bit different. Just down I-64 from DV8 Kitchen, I had the opportunity to visit a YMCA safe space to spend time with kids, this demographic that is most at risk. That looked different from the bakery, that looked different from what happened here on a daily basis. Just some inspirational leadership in every one of those grant recipients. And I will tell you, it was a personal honor that I appeared before the commission. I tell you, they were tough up on the dais. They weren't too hard on me, but I appeared before the commission and very solemnly asked for $3.6 million for us to lead a statewide, evidence-based, data-driven prevention effort. Those of you in the military and law enforcement, for us to get ahead of boom, as we would say, for us to use this and social influencers and partnerships with the University of Louisville, the University of Kentucky, go Cats, Western Kentucky University, to go to where the kids are, to use these influencers to show them that there is a better way, to show them that they are better off without it. And you will probably not see these efforts because they're targeting, not to be ageist, but they're targeting a bit of a younger demographic than are seated here. But I am excited about this effort, and we're gonna save lives in a different way through prevention. Finally, I just wanna, they call it primacy and recency. You learn it in law school. You emphasize when you're speaking before a jury or any crowd, what's most important. You speak right out of the gate at the front end or at the back end. So I want to end by again saying how honored we are to partner with VOA, how honored I am to partner with this strong leader, partner with you, Maria, how just honored I am for us to be able to engage and combat this opioid crisis. Now I'm gonna finish by thanking you all for being here today, but I have the privilege of introducing, I'll tell you, Hollywood has its own Captain America. They have their own Chris Evans. I say without any joke and with total sincerity, we have our own superstar, our own superhero, Chris Evans, and he's here today. He's sitting over my shoulder. I'm gonna call up the former acting administrator of the Drug Enforcement Administration, the former special agent in charge of the DEA Louisville division, which was very important to me as he built out that effort to go after drug traffickers here in the Commonwealth. Asking him to serve in our administration, his willingness to step into the fight in a different capacity. I'm gonna call him up and let him talk a bit about his new role in this partnership as the executive director of our Opioid Abatement Advisory Commission. Director Evans.
Thank you. it's always a pleasure to be with you. It's always hard to follow the Attorney General, so I face that challenge. But Jennifer and the VOA and the staff in particular, I want to say thank you to all of you for the opportunity to be here with you today. I just want to speak briefly just to make sure a little clarity in terms of what the Commission is doing and why this is so important to the Commission. On behalf of the Commission staff and the Commission members, we've looked and realized that the work that we do is to support communities and support others. Today, being here gives us an opportunity to see the work at hand and to see the work being done in meaningful, truthful, and pure ways. And that's important for us. We want to make sure that the funds that come from the Opioid Abatement Commission are utilized in a way that make a difference in the communities across the Commonwealth. And that's what we're here today to see. And we've had the pleasure of being able to see, hear about, and be able to witness the testimony about the work that's being done by the VOA staff here in the region and the support you all are giving to everybody. It's important to understand that, again, the role of the Commission is to support those efforts across the Commonwealth. We want to take that money, and as the Attorney General referred to it as blood money, and try to change the trajectory of the opioid overdose crisis and what it looks like in substance use. We recognize that that's a challenge, but we also recognize we have to be smart, we have to work hard, and we have to put all of our energy into making sure it's better. So that's part of what we want to make sure happens. And quite honestly, being here today, the takeaway I've seen is that that work is moving forward in the way it needs to. We've been able to see people who are committed, resolved, caring, passionate, and willing to make sure that they do what's necessary for somebody who walks through that door. It's not an easy task. We get to stand here and talk about the work that's being done. We get to talk about the money that's coming through the state. But the hard work is the work that happens when somebody walks through that door and somebody says, yes, I'm with VOA, I'm here to help you. And they take that hand and lead them on a path to a new life. And that's what we're here to celebrate today. And we're thankful for the opportunity. We're thankful for the opportunity to support you and the work that you all do. And I want to make sure that you know that we will continue to do that and to continue to support organizations across the Commonwealth doing the good work. I do want to close. We've been asked very frequently what the time frame looks like for the Commission and when the money is going to open up again. So to answer that question, next month the applications will open up again for the next round of grants from the Opioid Abatement Commission. So we anticipate to hear from a lot of people in regards to that. But as we have been through this process, we want to make sure that we continue to collaborate with everyone. We want to make sure that we have transparency in what we're doing, and we want to make sure we're accountable with the dollars that we're entrusted with. So on behalf of the Commission, the staff, I want to again thank you all for the work that you do. Thank you for being here with us today. And with that, I'll turn it back over to Hancock.
You can see what a special partnership this is. Again, we're just so grateful that you're here to witness this partnership, to see what we're doing here. Not just our Recovery Community Center, we have our Family Recovery Court. Of course, that's Judge Venters and Vanover that are helping us drive that Family Recovery Court in 3 counties, but our Pulaski office is here in this space, along with Family Connections, which is an innovative partnership between Volunteers of America and the Department of Community-Based Services. We're going to give a moment for our media now to ask any questions that you may have before we wrap and close and have an opportunity to meet and greet with the General and his team.
Oh, I guess that means me.
You've got the floor.
Oh, yeah, sure. So obviously this is an amazing impact that you guys are having on the community. This partnership is going to impact so many lives. What does it mean to not just, because like you said, we don't just serve just one county, it's several counties that are able to come here and receive that help. How do you guys feel that this is going to make that impact in the community as a whole, not just here in Somerset, but throughout southeast Kentucky?
I'll say this, we want to think regionally about everything we do. We have a tendency in Kentucky to get into our county silos, and I don't think that always serves us well. We have some friends here from Wayne County that are here to learn more about what we're doing here, and we're hopeful that we can continue to spread the message around destigmatizing this issue, using the real people, the real faces of long-term recovery to cast a vision of hope and what's possible, and then to bring counties together. When I first met with Judge Venters, it was at the invitation of Representative David Mead. He said, I want you to meet my judges. I think they'd really love a partnership with Volunteers of America, because he heard about the impact of what we were doing in Clay County with our Family Recovery Court. We took a little bit of state money, we went and got a federal grant from DOJ, and now we built out this robust family court under the leadership of Judge Harris in Clay. One conversation sparked the next, which sparked here a few years later a 3-county partnership where we have 3 recovery community centers, family recovery court in all 3 counties, and other services that we want to locate here. In Stanford, we're building a Freedom House right now. So it just takes one conversation, one meaningful, sincere partnership, and I have no doubt that this will continue to get socialized and spread throughout the region.
And that's also super amazing. For the Attorney General, I have a question for you as well. I know obviously, I went to one of these opioid epidemic, it's called Embrace Hope last week in London, where they kind of brought resources together to help people that were either that knew somebody that was dealing with opioid addiction or somebody that actually was going through it actively. And I got a chance to talk to the sheriffs down there, and one thing that stuck out to me was they always said, the misconception that as law enforcement officers, our job is to put these people away in jail. But obviously with this initiative, it shows that you guys aren't. You guys are trying to do other things, reach other avenues to help now with this initiative, help the youth from even getting into that, to these substances. Can you kind of just speak on, like you said, we're not focused on just putting these people away, we're focused on prevention and keeping these people and children on the right track.
The challenge that has killed so many and destroyed so many families in this Commonwealth to effectively push back, it requires, I'm a West Kentucky guy, so we'll call it the 3-legged stool. One of those legs is enforcement. One of those legs is robust enforcement. It is sending those that traffic, that bring this poison into our Commonwealth from over a porous southwest border. It is removing them from the community as long as possible. We're going to continue to do that. We're going to continue. We support our county, our Commonwealth attorneys. We're going after those that bring the poison here, that profit from the devastation. That's one leg. Treatment is another. That is an absolute necessity. And what this wonderful facility does is it helps facilitate treatment. It helps get those that needed treatment. I'll tell you, 5 years ago, if we needed a treatment bed, good luck. Wait in line. There's a 6-month wait. Someone who's in acute active addiction, we lost too many because we couldn't get them a bed in time. This Commonwealth now, I'm proud to say, it has per capita more treatment beds than any state in the nation. Now, we need to constantly improve the quality of that treatment. That's very, very important. But that's the other leg of the stool is prevention, and that's what we've failed at. That's what we've failed at. I will just flat out say that across the board in this Commonwealth, because when we exist in an environment where as little as one pill can kill, one pill that my son thinks is fentanyl, it isn't fentanyl, but is Adderall, it is an ADHD medication that a child is given, or that something that comes out of a medicine cabinet. This will help you study. This came out of a medicine cabinet. It'll help knock the edge off after that tough practice. And we're losing kids to that scenario in this Commonwealth. And so we need to lean in on the prevention space. That's the direction that I've asked the commission to pivot towards. That's the direction they're investing in, $12 million this last cycle, very prevention centered. So it takes 3 legs of that stool to effectively push back.
Yeah, like you said, it takes, like you said, all 3 legs in order to do that. And I did a little bit of research for coming to get the Kentucky overdose report from 2023. Overdoses have gone down 10% since last year. Obviously, that is great to hear, but like you said, the work is yet to be done. There's still work left to do in this community to be able to prevent anyone else from having, like you said, you can't fill the seat next to you from the person that passed away from this, but you can do everything you can to prevent that from happening to somebody else's family. Can you also just speak on how the collective in all these departments coming together, the importance of everybody saying, hell, this is something that we're fighting together, and the events like this show that you guys are really trying to make that impact?
I'll ask Jennifer to come up in a moment, but let me say, we celebrate every one of those lives saved, that reduction. But talk to the families of the 1,984 Kentuckians that have that empty seat at the kitchen table. So we have so much work to do. We celebrate improvement, and improvement is a product of efforts like this, but we have a long way to go, a lot of proverbial wood to chop. Let me say this before Jennifer addresses this. It is very easy to look at those 1,984 deaths and all of the active addiction that we face in this Commonwealth, the tsunami of substances that are coming over that border that we're fighting in law enforcement. Or it's very easy for any of you or your viewers to read the news scroll or turn on the TV to focus on the darkness, the divisiveness. But I will tell you, events like this, there is so much cause for hope. As someone that has the privilege of traveling across the Commonwealth, I get to stand and make this drive and stand in this beautiful county in Autumn and Pulaski County in Somerset and talk about collaboration, about tearing down silos. I get to see leadership, nonprofit leadership like this. I get to stand before some of the most talented leaders in this Commonwealth. I see Mayor Keck. I see mostly Mayor Keck's socks, which are extraordinary, but I see Mayor Keck as well. And I see talent and innovation and creativity. I see our former Chief Hunt here, someone that a leader in law enforcement in doing creative things to tackle these challenges. I will tell you, there's so much cause for hope. That's why I'm so excited to be here. There is so much reason to focus away from the darkness, and that's what we're here to do, to push back on that narrative that we are circling the drain. That's not the Commonwealth that I see. It's not the Commonwealth that I serve. And just looking around the room is a reminder. Just hearing the story I heard a moment ago is a reminder that we have so much cause for hope. Ms. Hancock.
General, I see my friend Don Ling here from Operation Unite. I had the privilege of spending some time last week in Pikeville at the SOAR Summit with Congressman Rogers, and he reminded us about why he founded Operation Unite. It was the same three legs of that same stool that he thought was so critically important: prevention, treatment, and enforcement. And so, the General said it so beautifully that so many of you, I see our leaders from law enforcement are here. You're here because you have a passion and a commitment to collaborate, and that is ultimately in our DNA. We've been around a long, long time, for 128 years, doing the good Lord's work, I like to say, but we cannot do it alone. We can't do it all. And so it really is a team sport and a team effort, and I just think so many of you who feel called to partner with us. We didn't have to have the red carpet rollout that we've had here, but you all have ensured that we've felt at home here and welcomed here from day one. I even was sharing with the General when he arrived that we had some smart advice that we should probably just get adjusted and get integrated into the community, maybe a little bit more quietly, because there have been some challenges from some other kinds of providers, and we didn't want to get painted with that big broad brush. We wanted to differentiate ourselves as a quality provider that means business, that is that steward model that you heard the General speak to. That was wonderful advice. At first I was like, I want to throw the party and I want to tell everybody we're here. I want people to know that they are safe here to come. But it was actually the best advice we could have received. Be authentic, be quiet, sincerely integrate, and then we'll do the ribbon cutting a year later. That's the kind of partnership that's so meaningful. It's so sincere. So thank you again, and I love your question about partnership and collaboration.
I also have one final question for you. I'm so sorry before you walk away. Can you kind of just talk a little bit about how these fundings will go? I know, like you said, this will go towards getting influencers to reach the children about talking about staying away from substances. Can you kind of go in depth a little bit about how, which influencers or how that stuff will be determined, and anything else that may go into this program?
So we're building this model as we speak. The direction to Director Evans was to look across the country and beg, borrow, and steal what works in the prevention space, to focus on that youth demographic, to prevent first use, prevent use in this era of that one pill very much killing. And so the director and Jesse Halliday from his team brought in a partnership from Florida, from Broward County, Florida, called Better Off Without It. And this is an effort that has been demonstrated to reduce use. This is an effort that focuses on name, image, and likeness. It focuses on social media influencers, can target down to an area of a zip code to identify who are in a problematic area that's wrought with overdoses, targeting who are the social media influencers in that zip code. What this looks like standing in Lincoln or in Rockcastle or here in Pulaski County might look a lot different than it does in Paducah or Logan County, because the influencers may be a bit different. Pretty sure the through line of the University of Kentucky will be throughout, and partnering with U of L in NIL. That's using players, using leadership, hopefully from the team, to look at these kids and say, I am better off without it. And before you dismiss that as being Pollyanna, it works. The data says it works. The data says that kids in that demographic, 13 to 26, they're very focused on health. They're very focused on being impacted by those they look up to. Now, oftentimes that's for ill, as we've seen, but we seek to, there's a line from Genesis actually that applies to it. We seek to use it for good. We seek to use this in a way, again, that many of this room may not see these ads, may not see this degree of influence, but it's been demonstrated to work. And so $3.6 million will be invested in this effort in the next 2 years by the commission. And so stay tuned. We're going to roll out some of this year. Most of it will be next semester. We've message tested this, just demonstrating that it will look different in the West maybe than it does in the East, than it does in Jefferson County. We've message tested this and are continuing with kids, with young people from all of these regions across the Commonwealth, going to this notion of we serve the entire Commonwealth, not simply the Golden Triangle, and we'll be impacting all 120 counties. So hopefully that a lot of this airplane is still being built in flight, because this is being done statewide in a way that has never been done here in the Commonwealth and has never been done nationally. We're going to be at the tip of the spear here. I'm so proud of that here in the Commonwealth. That's being invested. Those resources are being stewarded for that outcome.
Thank you all so much for being here.